Fuchs dystrophy. Fuchs endothelial dystrophy is a hereditary abnormality of the inner cell layer of the cornea called the endothelium. The purpose of this endothelium layer is to pump fluid out of the cornea, keeping it thin and clear. When the endothelium is not healthy, fluids are not pumped out and the cornea develops swelling, causing it to become cloudy and decrease vision. Fuchs dystrophy usually affects both eyes and can cause your vision to gradually worsen over years. Typically, the disease starts in the 30s and 40s, but many people with Fuchs dystrophy don't develop symptoms until they reach their 50 or 60. Fuchs dystrophy is usually inherited. The genetic basis of the disease is complex. Family members can be affected to varying degrees or not at all. Factors that increase your risk of developing Fuchs dystrophy include 1. Sex. Fuchs dystrophy is more common in women than in men. 2. Genetics. Having a family history of Fuchs dystrophy increases your risk. 3. Age. Older, there's a rare early onset type of Fuchs dystrophy that begins in childhood. Typically, the disease starts in the 30s and 40s, with symptoms developing thereafter. There are 4 stages of Fuchs dystrophy. This type of corneal dystrophy can be progressive, so you might experience worsening symptoms on a regular basis. In the early stages, you may have blurry vision that's worse upon waking up due to fluid that builds up in your cornea while you sleep. You might also have difficulty seeing in low light. The late stages cause more noticeable symptoms because fluid buildup or swelling doesn't improve during the day. Note: signs and symptoms of Fuchs dystrophy can be difficult to detect at first. As a rule of thumb, you should always see an eye doctor if you experience vision changes or discomfort in your eyes. Treatment for Fuchs dystrophy can help slow down the rate of corneal degeneration. Without treatment, however, your cornea may be damaged. Depending on the level of deterioration, your doctor might recommend a corneal transplant. There is no cure for this corneal disease. The goal of treatment is to help control Fuchs dystrophy effects on your vision and eye comfort. Conclusion: Fuchs dystrophy is a progressive disease. It's best to catch the disease in its earliest stages to prevent vision problems and to control any eye discomfort. Thank you very much.